In this video, I'll be talking about the different nerve roots of the brachial plexus of the upper limb, starting with the axillary nerve. Now, the axillary nerve is getting its innervation from C5 and C6 nerve roots. Now, in order to understand that in a little bit in more detail, let's do a very quick review of the brachial plexus. Now, the brachial plexus is divided into C5, C6, C7, C8, and T1. C5 and C6 combines to form the upper trunk. The C7 forms the middle trunk, and C8 and T1 forms the lower trunk. Now the trunks eventually becomes cords, and the upper trunk eventually gives rise to lateral cord. The middle trunk gives rise to posterior cord, and the lower trunk gives rise to medial cord. Now the cords then gives rise to branches. The lateral trunk eventually gives rise to musculocutaneous nerve. The posterior cord gives rise to axillary nerve and radial nerve, and the medial cord gives rise to the ulnar nerve. The medial cord and the lateral cord together, they gives rise to one nerve, and that would be the median nerve. Now this is a very crude depiction of the brachial plexus. Obviously it's more complicated than that, but this is a very crude outline. Now you see, this is where our axillary nerve is. It's coming from the posterior cord. Now the posterior cord also gets innervations from the C5 and the C6 nerve root. And the C5 and the C6 nerve roots eventually ends up in the axillary nerve root. And that's why we have it here, that C5 and C6 is going to form the axillary nerve. Now let's take a quick look at the dermatomes of the axillary nerve. We can see that the top area is supplied by the supraclavicular nerve, and then the green region is going to be our axillary nerve. Now let's see what the green region really, which nerve root supplies the green region. So it would be around this area, and you can see that the C5 and the C6 predominantly dominates this area, which is the deltoid area, because axillary nerve supplies the deltoid. Now let's move on with that idea. Now we're going to be talking about causes of injury. What really causes axillary nerve damage? So really there are three causes of axillary nerve damage. Number one is going to be surgical neck fracture. So if we have surgical neck fracture, we're going to see axillary nerve damage. So where exactly is the surgical neck? Surgical neck is right underneath. It's the neck area, obviously. It's this area over here, the surgical neck of the humerus. If that is damaged, then we are going to have axillary nerve damage. Now, other than this one, there is also another very popular one which also leads to damage of the axillary nerve, and that is dislocation of the humerus, which we know that some people have very shallow pocket of the where the humerus sits on the socket. So oftentimes it just pops out during sports, or just pops out just like that sometimes. So dislocation of the humerus also gives rise to axillary nerve damage. Either it's posterior or anterior. And the last one is going to be, which is thoroughly avoided, is intramuscular injections. So if someone is injecting intramuscularly over the deltoid, you run the risk of damaging your axillary nerve. So obviously damage to the axillary nerve is going to cause some motor deficits. For motor function, it's going to cause damage to the deltoid, because deltoid is supplied by the axillary nerve, and the sensory deficit is going to be the cutaneous sensation over the deltoid is going to be affected. So that's what we're going to see in the sensory deficit. And finally, when we're looking at the sign, when we have axillary nerve damage, there's going to be deltoid paralysis. You're not going to feel anything on the lateral arm, on top of the lateral arm, and you're also going to have a flattened deltoid. So it's going to look like your one side of the shoulder has drooped because of the lack of muscle tension. So that's a sign for axillary nerve damage. So that is my take on the axillary nerve. In the following videos, I'll be talking about the other nerves of the upper extremity.